Let's discuss what it looks like when a baby has a good latch. It's so important to make sure that your baby has a good latch. It not only affects the way that baby intakes milk, but it also helps to protect your breast tissue and your nipple tissue to make sure that they are not causing any damage. There are a few things that you're going to want to look at when you are watching your baby latch. I'm going to show you our top suggestions on a few slides and then show you in detail in the pictures what I'm looking for. First and foremost, a good latch should be comfortable. Your nipple has never been stretched or sucked on like this before, so it is normal to have a little bit of pinching or something, but it should resolve once baby is fully latched on. The latch should be very deep, having their nipple reach all the way back to their soft palate. If you want to pause for a moment and move your tongue to the back of your throat, that's your soft palate. And most of the areola should be in your baby's mouth. You never want them sucking only on the nipple tip. You also want to make sure that your baby's lips are flailed and soft. They should be in a flange-like position, kind of like a duckbill position. And they should have a nice wide open mouth while latching. You always want to make sure that baby's chin is touching the breast and that their airway is open. If you have larger breasts, sometimes it may look like baby's nose is squashed, but as long as you can see one nostril, they should be fine, but you always want to just be certain. So just to go over those again, I wanted to show you the nice wide latch this baby has and show you the chin is touching the breast and not the nose. You can also tell that it's a nice wide latch on the way that the chin is positioned. You can see that the mouth has stretched wide open so that they can fit the whole nipple in the mouth. This is a great example of soft, relaxed, flailed lips, and also showing that there is no excess areola outside of the baby's mouth. The reason that this is important is because the tip of the nipple is only one part of the function. If you were to have the baby only suck on the nipple, they would not be getting actual milk in their mouth because they're not sucking on mechanisms that actually bring in milk, and it would cause a lot of damage to the breast. And lastly, you want to make sure that both you and your baby are comfortable. You want to make sure that you are in a seated position or a lying down position that is supported. Make sure your back and neck are supported, however works for you. Make sure that baby's head and body feel supported so they're not wriggling around, which could cause damage to the breast tissue and make both of you have a harder time with latching. In this video, you can see this sweet baby latching onto his mother's breast, getting the tissue nice and deep. Takes a few tries because he's brand new. And then actively sucking. One thing you want to look for with a baby is that their full jaw is moving and you can see him swallowing. His mother's flow actually is very fast, so he's chugging, but for most parents, it'll be a nice, steady suck, suck, swallow pace. You can also see the joint by his ear moving, and that is another good sign of a good latch.